Chapter 45, Nursing Care of the Child with an Alteration in Tissue Integrity, Integumentary Disorder. The objectives for this lecture are to distinguish between different integumentary disorders in infants, children, and adolescents, to identify nursing assessments and interventions, describe types of burns, criteria for transfer in family education, discuss human bites, insects, and stings, and then talk about a little bit of the psychosocial aspect, especially in the burn area. For integumentary disorders, we're going to start off with bacterial disorders, bacterial infections, and one of the biggest ones we see in kids is impetigo. You have a bullous and non-bullous. So bullous is more of the wet ones, as you can see in the picture, usually caused by strep A, more common in children. And then the non-bullous is caused by strep A and staph. Staph A and strep, excuse me. And so it's more of a dry, honey-colored, crusty infection. And then sometimes they do have other infections with it, like a dermatitis, things like that. There's other types of skin disorders, but we really note this impetigo one in particular in kids. As far as medications, just teaching about the therapeutic management of it and continuous medications until the infection is gone. The next thing we're going to talk about in this chapter is burns. So there's a large amount of kids that are burned, and it seems that it's a preventable condition. Young kids get burned from pulling down hot pans off the stove, or infants can get burned if the parent is drinking a hot cup of coffee and they pull that down on them. Kids have gotten burned, in my experience, making ramen soup and then getting burned on that. Ramen soup, probably as some as you know, is really hot when you take it out. And then really right now, burns are the fourth leading cause of injury. So mostly in pediatric kids, they don't result in death unless it's a house fire or something like that. But they may have some disfigurement or disabilities from them. And then there's also burns that are related to child abuse. When we think about burns, we used to call them first degree, second degree, and third degree burns, but we've changed that way that we describe it. We talk about partial thickness, which superficial, partial thickness, deep thickness, and then full thickness. So your superficial is just the epidermal injury, so it heals. So that's burning yourself on the stove or burning yourself with a curling iron, something like that. Partial thickness involves the epidermis and then portions of the dermis. So it will heal, but it'll take a little bit longer. Deep partial it's going to take a long time to heal. It could possibly cause a scar, and it could change things like hair growth, things like that. And then you have full thickness, which partial thickness and full thickness could require some surgical interventions. Full thickness will extend through the epidermis, dermis, and then hypodermis. And severe scarring, hair follicles and sweat glands would be destroyed. Full thickness burns take a long time to heal. And sometimes there could be underlying bones or tendon involvement. And then if that is the case, they would note them as fourth degree burns. Sometimes there's contractures because of the skin, and the grafting is sometimes necessary. So what happens in a burn is the burn tissue coagulates after the injury, and then that reaction can actually extend the burn. One of the biggest things with burns is fluid loss. So the blood vessels have that increased capillary permeability, so there's a lot of vasodilation, and that's going to cause a lot of loss of water and electrolytes to leak out of that vasculature. Edema very early on forms. One of the biggest things that you need to be aware of at any age is burns to the face, neck, because if they have edema, then they're going to lose their airway. So typically those type of burns to the face and the neck, if they're severe, they will go ahead and intubate the patient electively, because once that swelling starts, they won't be able to intubate them. And if they don't do it, they would lose their airway completely. So fluid loss is, your book says, about 5 to 10 times greater than that from undamaged skin. Initially, a child will have a decrease in their cardiac output, but then they'll have a heightened metabolic state, and that will increase. And then children who aspirate hot liquids also have more of a airway altering edema. So for the burn, kind of what you want to do first is stop the burn. So get the clothes off, rings, so any type of jewelry, because those could keep burning. So get the clothes off, and get everything away from them. I remember a small child who came in, was in a house fire, was doing okay, but just inconsolable, and nobody had really taken off his diaper, and he had some, like a coin in there that was continuing to burn. So like I said, jewelry. Also, you want to get jewelry off because of the edema. You won't be able to get it off at a later time without cutting it off. So fluid resuscitation is really your main concern. Again, if respiratory compromise, you want to get that taken care of first with intubating or something like that. But you want to just get large bores IVs in them so that you can resuscitate fluid quickly. One of the biggest things, of course, we always have to think about abuse, is whether the history sounds like what could happen. If you are sticking your hands under hot water and it's too hot, you pull it back, you'll have splash burns or splash burns from hot oil, something like that. It's asymmetric, but then intentional scald burns would have more like a stocking or a glove, and you'll have lines, what they call lines of demarcation, so you can see exactly where the child's hands were held in the hot liquid. And then they have a degloving where that skin will come off. Also, just kind of assess for abuse. Kids are burned by curling irons, gasoline, fireworks, room heaters, ovens. Just get a detailed explanation of it, and if you suspect anything, report it, of course. Some of the child abuse burns, there's a little box on page 1762, and it talks about the inconsistency in the story. Delay in seeking treatment is always one of them. The uniform appearance of the burn, so clear delineation of the burned and non-burned areas. So a hot object that was held on the skin, some type of a coin that was burned and held on there. And then also lack of spattering or lack of splash marks. Any type of burns that are on the dorsum of the hand, or something that looks like a glove pattern around the extremity. You want to investigate that further. So here's your superficial burns. So red, pain at the site. Partial thickness is blisters, intense pain, white to red skin, and then you can have moist and mottled skin. And then full thickness. Once you get to the full thickness, you'll have that charring of the skin, and also little or no pain because now you've burned the nerves. So that's concerning. When measuring a burn, it's really important to use the same type of measuring tool. There's a couple different ones. There's the rule of nines, where each portion of the body is related to the number 9. There's also the palm type of measurement, where you measure the child's palm, and child's palm is 1%. and then you just see put their palm on around and see how much the burn is, or measure their palm and use a measuring tape. Make sure you use their palm and not your palm, because that's going to make a big difference in how that measurement is obtained. Usually there's, we talk about criteria for transfer to a burn center, and so that measurement is important. So lab tests, we'll do electrolytes, CBCs, we'll culture the wound drainage if there's any. Nutritional, we need to worry about nutrition if that has affected their airway. What's their pulmonary status? And then looking for inhalation injuries. And then you want to do some type of cardiac monitoring for electrical injuries, such as, putting something in a wall socket, or also lightning burns, lightning injuries can change your heart rhythm. So every hospital has a criteria to transfer to a burn unit. There are no burn units here in Tucson. St. Mary's used to have a big one, and that they closed that a few years ago. St. Mary's does do some burns. Banner does do some burns. It really depends on the criteria. Mostly kids are transferred to the burn center in Phoenix. So partial thickness that are greater than 10% of the body is typically a transfer criteria. Anything that involves the face, like I said, there's possible of airway compromise if it involves the face. People who, not kids, but people who smoke and they have oxygen going, there's often problems there too. Any type of burns that involve the hands, feet, genitalia, perineum, or major joints, those are going to be more extensive. Also, those are involving growth and development, especially in kids. Electrical burns, again, that can cause a burn on the skin. It also can cause a change in your heart rhythm. Chemical burns, inhalation injuries, all of those also. Any burns where kids have pre-existing conditions, so if they're immunocompromised, something like that, those would be transferred. Traumatic injuries, anyone who needs long-term care, so for types of burns, skin grafting, things like that. Or if there's nobody there to take care of the person that has the burn, they would be transferred. So our goals for burns is to always promote that ventilation and oxygenation, restoring that fluid volume. Like I said, there's equipment called rapid infuser. And because if you think about how fast could you get in a liter of fluid if you were giving it to a person, of course, with kids, we go by weight. But even if you put a pressure bag on a liter of fluid, it would take you at least probably half an hour to get that in, pump an hour to get that in. So a rapid infuser is a machine that can infuse like a liter of fluid over probably 5 to 10 minutes. And they have those in the trauma area. Preventing hypothermia. So you're taking all their clothes off, but you're getting them, sometimes there's, with that rapid fluid shift, they become hypothermic. Cleaning it, preventing infection. So managing the care. When a patient has a burn and dressing changes are done, they will use strict sterile technique, treating those burns and then providing that rehabilitation. Not only rehabilitation as far as skin grafts and things like that, but psychological rehabilitation is important. And what we want to do is our primary and secondary survey. Anytime you have a trauma or drowning or a death, you always, if on the scene or possible death, you want to always start with your primary and secondary. So your airway, breathing, circulation. When we talk about the airway, we need to assess it. Was there any burns around it? Are they talking? If we suspect any black smoke around their face or any black sputum, then that's concerning of airway compromise. Color, so are they breathing? How are they breathing? And then the pulse rate. Are they perfusing? And then start to document the location of any edema that's happening. Your secondary survey is determine the burn depth. You're also going to determine the percentage using either the There's a BSA chart, there's the rule of nines, and there's also the palm technique. And then also look for any other injuries, because if they've jumped out of a window or anything like that, they can have some cervical spine or internal injuries. Okay, sunburns. I'm going to talk a little bit about sunburns. So kids under about 6 months old to a year can't really maintain their temperature properly. So having them in the sun is a bad idea. And you can see just 5 hours at the beach for this little kid, 48 hours later, and 72 hours later. Pretty miserable. So being careful of UV rays. Frostbite, we don't think about frostbite here in Tucson too much, but I lived in upstate New York where it'd be 30 below in the summertime, in the wintertime. And so we did worry about frostbite. So as far as frostbite, they're calling it cold injury, and they categorize that on 1st to 4th degree. And like I said, I haven't seen any of things like that out here in Tucson. Human bites and stings and spider bites. So human bites are very dirty. We see dog bites a lot. Any human bite or dog bite is reportable to the police department. Animal bites, any type of animal bites are reportable to animal control. A lot of times we see fights, especially in the adult world, where human bites have become very, very, very infected. That's a really nasty picture I found on the internet. And then cleaning the wounds is important. Also rabies prophylaxis. So if it's not indicated that the dog or the animal has had rabies shots, of course, if it's like a bat or something, that they automatically would have rabies series. They can get secondary bacterial infections from the wound, strep, staph. Cat and human bites are the ones that are likely to be most infected. So education on not provoking dogs, things like that. And then kids also have some emotional stress when they are attacked by a dog or bit by a dog. Insect stings and spider bites. So bees, wasps, ants, yellow jackets, hornets, spiders inject their venom when they bite. So that's why usually there's some type of a local reaction. You can get a systemic reaction like an anaphylaxis. You can even progress to a anaphylactic reaction from it. And then brown recluse and black widow spiders are obviously the worst. A lot of the times there's pain, there's edema. We see scorpion bites in kids, and scorpion bites, there's just a little box on it. Scorpion bites will affect the elderly and small children the worst. If you get a scorpion bite, you might have just pain at the site, but small children and elderly, I don't have experience with elderly being bit, but small children I do, and they will become crazed. It affects their CNS system. They'll come in, they're just like all over the place. We usually have to give them a shot of Ativan or Valium or something like that just to calm them down. Kids get bit because they leave shoes outside and then they go put their foot in the shoes, and that's where scorpions hide. There is a antivenom called Anascorb, which is what we use for kids. Same with snake bites. We use an antidote called Crofab, and those two items are very, very expensive because of the how they have to obtain the venom for that. So, but the Anascorb we use is pretty significant. It will reduce those symptoms rather quickly. And that's it.